So if you call poison control, you want Kathy to answer the phone. Uh, in addition to her duties as Senior Toxicology Management Specialist, she teaches, publishes papers, is active in the American Board of Applied Toxicology, and volunteers at the UCSF School of Pharmacy. Please welcome Dr. Kathi Meier.
So when I was asked to give a talk, so I'm actually I'm the toxicology board person on the board of MSSF, and they asked me to give a talk, and I thought, well, what do they want to hear about? Because I come from a very different perspective probably than you all, who are out there gathering and have culinary and other types of interests in mushrooms. So I thought, well, I got to play to my strength, which is what I know, which is kind of the health effects of mushrooms. Being at the Poison Center where I'm at, over 35 years, we've had different waves of different mushroom related cases or poisonings. And so I had, I have my own experience to share with you. But I really felt that it was kind of important to kind of go out and take a bigger picture. And so I'm hoping to share that with you today, because what I found was a little surprising, right? So why is this not moving? It's not moving.
Oh.
For some reason. The what? Oh, okay. There we go. So I'm going to kind of wind up briefly kind of introducing you to what poison centers are, then go on to define what I consider, or what most poison centers and healthcare professionals would consider severe poisoning. Look at some actual poisoning data that I pulled, contributory factors, toxin groups, and then kind of the mushroom groups that are associated with severe mushroom poisoning in the United States. All right. And then we'll wrap up and hopefully have time for questions. So when we look at poison controls are kind of represented on that worldwide map with little red dots. And so that is a kind of a worldwide kind of practice, I'd say. And we're a small niche. So poison centers are kind of the go-to experts on all kinds of things that might be poisonous. And what is poisoning? It's basically an injury that occurs after an exposure to something. Okay, so you're exposed to something and it injures you. So that could be anything. It could be snake bites. It could be, weapons of mass destruction. It could be drugs or chemicals or really anything. So toxicology really has a very broad kind of definition because there's so many things that can cause harm. Anyway, so there are different subspecialties of toxicology. For example, laboratory toxicologists or analytical toxicologists, who are very important. There's occupational toxicologists who focus on workplace types of injuries. And of course, environmental toxicologists that look at harm on the environment. But we're really talking about what we call clinical toxicology, which is the effect on humans and animals. Well, at our poison center, we do not specialize in animal toxicology. We really kind of forward all that on to the animal poison centers in the United States. We really wind up focusing on human toxicology. And so there's two kind of models in the world. There's a model for poison centers that only are accessible by healthcare professionals. So it's a doctor treating a poison patient somewhere and they can call. But then there's other models where it's all access, okay, where the public can call and healthcare professionals can call. So in the United States, Australia, Canada, New Zealand, and probably a few other countries, we have all access poison centers, meaning that anybody can call. We want everybody to call so that they can wind up getting a kind of a wise discernment of the situation and what they need to do about it, right? So in the United States, it's the America's Poison Centers kind of oversees and credentials all the poison centers in the United States. They have an actual online kind of mechanism to kind of look up your poison, which I put up here, where I put in I ate a mushroom, and you can kind of toggle through and see if it's something that might be harmful or might not be harmful. And I have to say that's actually changed our kind of our demographic phone calls over time tremendously in the last 10 years. The Calling the Poison Center is completely free. There's no charge. It's people who are answering the phone have actually been credentialed and certified. So they're allied health professionals. I'm a pharmacist. There's some nurses. There's some physicians who are answering the hotline. And they have to take a certification exam and be kind of meet criteria, which is defined by the American Poison Centers. So we deal with all potential poisons, anything. You get 2-year-old drinking the cough syrup, they'll call. The hospital calls us with some kind of a chemical exposure. We get everything. And we also do the important part of public outreach and poisoning, kind of poison awareness. Okay. One other thing that's very important is that the American Poison Centers maintains the NPDS, or the National Poison Center Data System. And this is really a important tool for public health to look at what is poisoning. Well, what are we getting calls about on poisoning in the United States? So if we look back at the last published report this is 2022. Well, if you look at 2022 here, there was 2,064,875 calls about poisoning exposures. That's a pretty big N to kind of look at what is going on in the United States. And what we can see also is that kind of a breakdown of the top 5. Analgesics is at the top there. Kind of how many 93% occurred at home. So it gives you some vital statistics there. The other thing that's really kind of important is this is actually kind of semi-real-time surveillance. And so you'll see on the lower left-hand side there, if you click onto the America Poison Centers, they'll look at things that are kind of trending. All right. And if we look at there, opioids are still trending. We get a lot of opioid overdoses, unfortunately, still. But there's also e-cigarette exposures, especially in young children, that can be harmful, or pediatric cannabis edible poisoning, which is a huge problem. GLP-1, like Wegovy and all those injectables, those are really difficult to figure out the dosing on, get a lot of errors on that. So this is actually real time. And so this was from a couple days ago, if you clicked on it now, there would be a different number. So if we look at national poisoning statistics, so we get 2 million calls a year. What does that mean? Well, back in 2000, the National Institute of Medicine tried to figure out how many were all of the U.S. poisonings. And that's the big green circle there on that diagram. So they wound up not only looking at poison center data, they looked at outpatient visits, hospital visits, death cases from whatever. And so what you'll see is what we wound up was the poisoning exposures are that blue circle. So it's probably the biggest subset of data that we have for poisoning statistics in the United States. And it's kind of nice because it's kind of real time. We can wind up getting blips and getting awareness if there's something going on. And I'll give you an example of why that kind of was helped us figure something out later. And so what we found is since the year 2000, the severity of poisonings have been going up, about becoming more and more severe, increased about 4.6% every year. So I think that people are going online and finding out that silica gel really isn't poisonous. If their kid just ate it, they don't need to call the poison center on that little nomograms, the online information kind of triage that they can do. But so I think that that's part of what is skewing this. But I think the other thing that's skewing is the horrible, opioid epidemic that we wound up going through. And there's other threats out there as well. So
some stupid thing on Instagram, and then I was like,
Actually, let me mute.
So in California, we have a California poison control system, And we have, we were founded in 1997 to kind of stabilize our funding base and make sure that it gave us more stable funding and better outreach to the state. And our mission is really to protect the health of Californians by providing immediate expert telephone advice for poisoning exposures and serve as the primary source of poison education in California. So we are funded through federal grants, and in the state, we're part of the State Emergency Medical Services, which is actually administered through the University of California. Okay. And we are accredited by the American Association of Poison Centers. So we have 4 answering sites throughout the state. All of them are UC affiliated centers. So we have UCSF, UC San Diego, UC Davis Medical Center in Sacramento, and we have Valley Children's Hospital in Fresno, Madera. And so we kind of carved up the state and wound up having this regional approach for our hospitals. But I tell you, people will call, and the public calls have the #1 priority, even over hospitals, because we want people to be able to get through right away and get an answer. So I'll get calls from Inyo County, about a rattlesnake bite, and those rattlesnakes can be kind of bad down there. Anyway, so we have 51 pharmacists, doctoral level pharmacists. We have 4 pharmacy technicians who take lower acuity calls, and we have backup medical toxicology experts in various fields. If we don't know the answer or if we're struggling with something, then we have backup. And we also have an academic teaching program. So we get to teach our pharmacy students, our medical students, our emergency medicine residents, and we have a fellowship program in toxicology. So when we look at what severe poisoning is, I think that everybody will have a different idea of what is severe. Okay. So our definition is severe is anything that really requires a medical intervention in hospital. Okay. So, somebody with a shiitake dermal rash, it's not really severe. It's not even moderate. It's kind of a minor rash. Nobody's going to that's not going to fit in here. So moderate effects really are signs and symptoms that are pronounced or prolonged, but not life-threatening. They do require medical treatment in order to recover. So that would be things like people who have hypotension, which is seriously low blood pressure below 90/50, and they need fluids. Okay. People with convulsion or a seizure, they probably need some treatment in the hospital to seizures get treated for that. Or new onset seizure. So liver injury, you can push your liver enzymes up there pretty high, but without dysfunction, that'd be called moderate. And then we go, but anyway, these are things that people recover with no deformity or long-lasting effect. Major effects are things that are life-threatening. So that would be like not just hypotension, but cardiovascular collapse. It's requiring epinephrine and norepinephrine, things like that. Or multiple seizures, which can injure the brain. Coma and respiratory depression, like we see with all our fentanyl overdoses. And then liver injury with dysfunction. And I'll talk about what that means later. And then, of course, there's death. But death is not the only endpoint, right? We don't want to die from mushrooms or anything else. So severe poisonings that's what I'm defining it as. All right. So what kind of mushrooms cause severe poisonings? I think we all think about the amanitas, right? And the liver damage and everything. So I wound up pulling the 2023 National Poison Data information, and they have mushrooms. So I could pull that data and actually look at it and say, okay, well, what if we look at moderate and severe, and then of course deaths, what's making people sick, right? So we had 7,215 mushroom poison. You can actually look this up too. It's all open access. 7,215 mushroom poisonings or mushroom exposures in 2023. 41% of those were kids under the age of 5, probably eating the mushroom off the lawn or something. And then 42% were treated in hospital. Okay. And then if we look at known outcomes, not all of these poison exposures are followed to outcome. Okay, so sometimes you'll refer people into hospital, you never hear from them again. You try to call them back, they're not answering, whatever, they're lost. So if we had 56% known outcomes. So we had a data set of 4,000 to 4,040 to look at. So, no effect, 23%, minor effect, 18%. But if we look at the serious effects, there was about 25% of those that had what I called that serious situation, where there was a moderate effect in 961, and there was a major effect in 91, and then there was 4 deaths, okay? Unfortunately, those were all under the unidentified mushroom. So, what I also noticed under mushrooms, processed and preparations, is there's a trend that's happening with unregulated kind of psychoactive substances putting into chocolate as microdose or other types of things. Okay, so that's something that started kind of in 2023-ish. We started to see more. We've seen more and more since then. So if I chart this over 11 years, what I noticed was that there was a disturbing trend that there was seemed to be more and more severe. The deaths are pretty stable, at least in our data set. But if we look at the severe cases from 2019 at 25 cases to 2023, 91 cases, there was a lot more. And I tell you, the number of poisoning data is always about 2 million something and change, okay? So it's not a bigger data set that we're looking at. We're actually looking at more and more severe mushroom poisonings. So what are those, okay? So that being said, that made me kind of worried. It's like, okay, well, what are this? It's like, it's not all just probably one, well, if we look back at this, it's not all one type of mushroom, and I'll show you how I sorted that out later. So I think we're taking a step back. We know that there's probably maybe around 5,000 mushrooms in North America. And we know that 100 are toxic or so. We know that, right? We know that 200 or 300 are safely edible. So if we do that math, that means there's about 4,600 that we have no idea. Are they edible? Are they toxic? Or what's going to happen? So, I think that there's a kind of a big unknown for me on my end. It's like, what was it? What can we expect? What can we anticipate? So we get, that makes us uncomfortable, right? So another problem that we have is that our proof of what was eaten and it's gone. We don't have any. It was consumed, and we have to rely on subjective reports of what the mushroom looked like, maybe, or where they picked it, and we don't really have any mycological type of or laboratory verification of what caused this illness. And so then there's also the problem with variable concentrations of mycotoxin within the mushroom itself. So I found one stat that with Gyromitra esculenta, there's like a range of 50 to 300 milligram, it might be per gram, sorry, not per kilogram, of gyometrin in the meat of the mushroom. So there's a wide range, right? Like a 6-fold range of the dose that somebody might get. So that dose makes the poison. So I think, that makes a difference too. And then we know that some mushrooms are toxic sometimes, but not always. So again, with Gyromitra, if you parboil them and dry them, it's going to get the toxin out and people eat it, right? So, and they're fine. And then, of course, we know Caprinus mushrooms are toxic only if you consume alcohol within 5 days. If you don't consume any alcohol or don't accidentally swallow your mouthwash, 2 days after your Caprinus ingestion, you're going to be fine. And then there's, of course, the weird, rare outbreaks of Morchella neurotoxicity that has been described. What's that all about? It's a mystery to me. And then, of course, muscle toxicity with this yellow night European trichloma mushroom, which, again, is widely considered edible, but occasionally is associated with this muscle toxicity. And it's an evolving science. There's newly toxic mushrooms that are identified, yes.
There was a recent case that was reported of somebody dying from eating dried Amanita muscaria, which normally is not considered to be that toxic.
I'll talk about.
Have you heard anything about that? Or?
I haven't heard about that case, but I will talk about that in general
Okay.
coming up. So mycotoxins are evolving science. So in China, between 2010 and 2020, they had 38,000 mushroom illnesses and 788 deaths. And so the Chinese CDC decided to look into that and figure out what's going on. About 90% of those deaths were consistent with an amatoxin cyclopeptide liver death. Okay. And so in 2022, they wound up looking at 482 mushroom incidences involving over 1,000 people. They had 28 deaths with a case fatality of 2.1%. And they were able to successfully identify 98 species associated with this through PCR work and other types of stuff. I'm not sure how they do that when they swallow the evidence, but somehow they were able to do it. I have to go back and look at the paper again. And they wound up coming up with 7 different clinical syndromes that were highly associated with risk of serious poisoning and death. And of these 98 species, 13 were newly recorded poisonous species, things that they had not found before. And they have some strange mycotoxins there, some in the mushrooms that can cause hypoglycemia within an hour, which is low blood sugar, which can kill you. And so, and it can't in some of these Chinese mushrooms. They're not here yet, I don't think. Anyway, so for me, it makes me even more uncomfortable because there's stuff out there that we don't know. And if you're not looking into it, you might miss it. So, risk factors contributing to mushroom poisoning. I always like to include this. It's usually the naive person. The person has no idea that a mushroom might be toxic. Oftentimes in our cases here in California, it's often people who are new immigrants that have no idea that they shouldn't just be going out and picking mushrooms and eating them. Spoiled or contaminated mushrooms, mushrooms that might be contaminated with bacteria or something like that can cause bacterial food poisoning. Raw mushroom ingestions. People with advanced age are at higher risk. You have less kind of margin to withstand maybe what might for a young healthy person be kind of a mild to moderate illness might throw an older person into much more serious injury. Co-ingested drugs, like for people with polysubstance use, for example, when I look back a few years ago, there was a strong association with severe hallucinogenic mushrooms when people were taking their methamphetamine at the same time. Not a good idea. Anyhow, and then resources. Are you in a developing nation where there's no hemodialysis or liver care available? Those countries are going to have much higher risks of bad outcome than in our country, probably where you can get kidney dialysis and all that care. All right. So if we looked at the mortality in undeveloped nations, it's probably around 58% from mushroom poisoning. But if we looked in developed nations, it's thought to be somewhere between 1.4 to 2.8%. So another problem is that we have this old classification poster, and here's this really beat up poster that I have, which gives us these kind of like really kind of 10 different groups. All right. And we try to push everything in here. And then at the bottom, there's miscellaneous and other, because you don't know where to put it and you don't have any evidence and you're not sure what it is, or maybe it's, who knows. And then there was recently by one of the Australians, this new classification proposed based on clinical symptoms. So the old classification was based on the toxin, and this new classification is based off of symptoms. And you know that you can make an argument for both, and I'll kind of talk about that going forward. So if we look at the old classification based on toxins, you know, there's a number of these newer mushroom syndromes that are out there that we might miss. And I've kind of pointed them, like the rhabdomyolysis, which means muscle breakdown, muscle toxicity, bone marrow toxicity, hypoglycemia, dermal reactions, and then other complex mixed. Okay. So this kind of new syndromic type of system, I kind of broke it down. And if we look at the syndromic, sometimes with muscle, or sometimes with, let's say, the isoxazole muscaria mushrooms. Okay. So in bad cases, you will wind up developing possibly some muscle toxicity, and the muscle toxicity can cause kidney failure. And so and then, where do you put that? Because now all of a sudden you're not identifying a chemical mycotoxin, but you're the syndrome, and now you got several syndromes, kind of several systems being affected. So it's kind of a problem both ways. And I'm still contemplating this problem of classification of poisoning. So if we look at these 2023, data set under moderate, major, and death, and wound up looking at those and I go, okay, what if I arbitrarily score, sorry, that should be a number 3 is major and a number 2 is moderate. Number 1 was minor. I think I did a little thing there, clipped it out. So 3 is assigned. So any of these cases for major would be a 3, scored a 3, and then 2 for the moderates, and taking the deaths out of it as a separate category. And so what I found is if we rank those just by the sheer numbers of calls that came into the poison centers, what's causing the most amount of poisonings? Okay. So number 1 was the unknown mushroom. And number 2 was the isoxazole mushrooms. Okay. Number 3 were the psilocybe mushrooms. Number 4 were miscellaneous mushrooms. Number 5 was the GI irritants. The cyclopeptides aren't even there in the sheer numbers of people being poisoned in the United States who are developing moderate or severe outcomes. Okay. I thought that was pretty interesting. All right. And then the cyclopeptides, all of the deaths were under other. All right. But I'm pretty sure by looking at it, 2 of them they were miscategorized. So if we look at number 1, the unknown mushroom, that's kind of a black box. What do we do with that? We can't really do anything except for maybe treat symptoms, which might kind of promote that syndromic classification of toxic mushrooms. All right. And so we have really poor cooperation between healthcare and the science here, I believe, because we really can't, what is causing this illness? It's kind of important to know. So number 1, might have a naive patient who doesn't know what they ate. They ate a mushroom. It had a cap and a stem. It was kind of white and kind of yellow. They can give you these very general descriptions, which you can't do anything. They don't take a picture of it before they eat it. The emergency personnel in the emergency department are just slammed. They're overwhelmed. Are they going to take a lot of time out to scientifically classify this unknown mushroom that the person? No, they're not. And poison centers even have become so incredibly busy. It's really hard. And if you don't have something to pin to, it's kind of hard to know because you're looking at one point in time. Poisoning kind of develops over time. So you can't really know what you're dealing with right at the beginning when you're doing the initial coding. And then, the mycology experts, if you don't have anything for them to look at, how are they going to be helpful? So I think that some of these clues might be in a deeper study of some of this data, and we might find out more on that unknown mushroom. So number 2 was the isoxazole syndrome. So this is really mushrooms that contain ibotenic acid and muscimol as their primary compounds. And that would be the Amanita muscaria, the Amanita panthera, there's others. And what that syndrome kind of classically does is that within about a few minutes to 3 hours at the latest, people will develop this biphasic kind of poisoning. At first, they're very stimulated, hallucinations, bizarre behavior, maybe a seizure, and then it's followed by coma and lethargy and maybe muscle jerking with maybe some muscle damage, and then how bad that is can cause kidney damage. And so the duration is somewhere between 5 and 24 hours. Okay. So why this biphasic type of presentation? Well, ibotenic acid seems to be the stimulant substance that kind of is on the forefront and probably gets metabolized and sequestered sooner, whereas the mescamol, which is a GABA agent, which is a sedative, lasts longer. And so this is kind of how the mechanism works, because I'm a physiologist and pharmacologist, so I'm going to bring this in. So this is normal homeostasis in your brain. You have GABA A, which is your sedative, kind of calming neurotransmitter. And then you have glutamate, which is your kind of excitatory neurotransmitter. Both of them are very important. Glutamate helps us with memory and learning and things like that. GABA kind of helps keep the nervous system under control, and it's in balance. But when we wind up taking something like the ibotenic acid and mescamol, what happens is that you might wind up, actually might start over here first, where you have so much glutamate stimulation that you get this excitation and your GABA isn't able to kind of level it out. All right. So hence like seizures, there's hallucinations and other types of things that can happen with a primary glutamate or reaction. And then as that wears off, you get a predominance of the GABA A effects, which is sedative and sedation. So that's kind of how that works. All right. So what is the treatment for this? So it's basically usually people who are very sick. I know that people use these drugs or these mushrooms as for, psychogenic reasons. But when somebody has a really bad reaction and they have a seizure, and they're extremely agitated and out of control, that's potentially very harmful on the body. All right. So what the answer is to give more GABA. So we'd give a benzodiazepine, like maybe you've heard of Valium or Xanax or something like that, to try and quiet things down. Because sometimes coma is our friend, especially in a situation of a hyperactive adrenaline state where you can injure brain or heart or something else. Okay. And then if they do develop muscle breakdown, you need to give them lots of IV fluids to kind of try and keep the kidneys working so that it doesn't wind up causing kidney damage, right? And then sadly, if you do wind up with really severe kidney damage, you wind up, the treatment's hemodialysis. So nobody wants to get to that. Number 3, the miscellaneous mushroom poisoning, another black box. What do we do with this? So when people put down miscellaneous, they probably have an idea that it might be something rather than unknown or other, right? So again, I think that it might be a case for syndromic type of classification of mushrooms, and it would require more investigation into what this data set really is. Number 4 was the hallucinogenic mushrooms, the psilocin type of mushrooms, which there's a number of them out there. There's a lot of them out there. And, it's a naturally occurring alkaloid, tryptamine alkaloid. There's a whole book on tryptamines that was written by a very famous local person here a number of years ago who looked at a lot of them. So tryptamines are very psychoactive. In the mushrooms, the primary compounds are psilocin and psilocybin. Now, psilocybin's a prodrug, so your body has to metabolize it to psilocin before it has a reaction on the nervous system. And they are considered Schedule 1 under the Federal Drug Control Act. So they are, basically not lawful in general. And there's actually been a renewed interest in exploring hallucinogens in certain types of psychiatry treatments. And so UCSF actually has a big research hub for this to see if it can help with certain types of treatment, all right, under a controlled setting, all right. So what happens? So within about 30 minutes, people start developing nausea and vomiting, probably. Actually, did I tell? Oh, gosh, this is kind of out of order, but so the symptoms that you would notice would be nausea, vomiting, dilated pupils, like sensory distortion, hallucinations, agitation. There's this depersonalization that occurs that actually is like part of the mainstay of the psychiatric therapy for people to be able to move beyond their trauma. Children actually experience seizures. Children are very different than adults and are very susceptible to a lot of drugs. Very different symptoms in young children, usually under 8 or 9. Fast pulse, increased blood pressure, and arrhythmias. So the heart can develop an arrhythmia. The duration is usually 6 hours for the main psychogenic effects. But what they found is on these PET scans, I'll show you a picture, next slide, is that it actually takes about 24 hours for the brain activity to restore to normal. Okay. And then there can actually be some lingering negative or positive psychological effects for maybe days or weeks. There is chronic tolerance that develops with this. So people who take these regularly can need more and more probably to have the same effect. And then the treatment is really kind of supportive in a quiet room and a lot of hand holding until the psychiatric effects go away, unless somebody is having what I call a Willy Wonka freak out moment where they are so agitated. Maybe they've had a seizure, maybe they're having an arrhythmia. And then we wind up giving them more GABA, Xanax or Valium or something to try and get them to calm down and reach a calm state. And sometimes it requires antipsychotic medications, which act on a different neurotransmitter. So at the bottom here is that pretty PET scan picture that I found, where it's the before on the left, during in the middle, and on the right is 24 hours later when it comes back to homeostasis, I call it. So the mechanism is really through our serotonin receptor. Psilocin is a serotonin receptor agonist. And so serotonin is a neurotransmitter in your brain and in your heart and in your blood vessels and in your stomach, and there's serotonin all over your body. But primarily it's going to affect the serotonin 1A and the serotonin 2 family, 2ABC, right? And it's the 2A, which almost all agonism or the effect of that 2A, which is really common to all hallucinogens. Okay, LSD, psilocin, all of these primarily affect that 2A. And it winds up, of course, altering brain function, increasing glutamate. You get all those symptoms of distorted perception. But one other thing that they've found, at least in a test tube, is that it promotes something called neuroplasticity. So neuroplasticity is the ability of different nerves to either grow or connect. Okay. And that's part of the research interested in this. So I have the neuroplasticity is the arrow going right straight down. The excitation is the middle one. And then the other thing here is the blood vessels. You have serotonin 2 blood vessels in your vascular, in your arterioles. And so it does cause vasoconstriction and it will drive up the blood pressure. So if somebody has underlying heart disease, it might, like, again, going to like an older age, you may not tolerate what you tolerated in your 20s or in your 30s. Okay. So as we get older, that could be a problem for some people. And then the other concern that I came across is that there's this theoretical concern that it also actually is a 2B agonist. And 2B agonism has in different drug models, not in psilocin, but in, like, remember, fen wound up causing fibrosis and heart valve dysfunction. So as these microdose psilocybin chocolate and other products become more and more popular and people are taking them more and more frequently, I think this is something we need to watch out for. It's theoretical. Is it going to happen? I don't know. But I think that I can't rule it out. All right. And people are starting to talk about it. So, going back to our NPDS, the National Poison Data System, in 2024, back in June through August, we started getting reports at poison centers that people are eating this microdose chocolate product and getting sick and winding up in hospital. All right. And they were symptoms that you wouldn't expect from a microdose chocolate bar. All right. So people were having vomiting. Well, maybe you did have vomiting. I don't know. Lethargy. Really? Seizures. Breathing difficulty where they had to be intubated. That's not expected. And hypotension or that required like adrenaline. So what's going on here? Did they really just eat this chocolate or did they take something else? You know, we don't know at the hospital. So when we go online, we find out from the manufacturer, our Diamond Shrooms products are meticulously crafted with proprietary blend of natural ingredients. There is no presence of psilocybin, amanita, or any scheduled ... So then what do? At Poison Control, we go on Reddit because we need to find out something because we don't know what's going on. And so in Reddit, I've had 3 bars, feels very similar to 4-acetyl-O-DMT, which is acetylpsilocin. Another quote, mental descent into fiery pits of hell, woke up strapped to a hospital bed. Okay. All right. Okay. So what's going on? Well, what happened was that the poison centers had reports from 34 different states. There was 180 illnesses cataloged. It was probably much higher than that, but we sometimes on our coding, if we don't specifically have the Diamond Shrooms chocolate blah blah, it may not get put in the data set. 73 required hospitalization, and there was 3 deaths. 3 deaths from a microdose chocolate bar. And these deaths were, so these people were then, of course, urine sent off for drugs of abuse screen. What else did they take? Because, you know, you wouldn't expect a chocolate bar to do this. So the analysis, so this blip brought in the CDC, the FDA, different labs to wind up doing some analysis. And what they found, and is had 3 different kava plants. So kava is a GABA agonist plant that is not scheduled. It's people use it. It's a sedative. It had O-acetylpsilocin, just like the guy on Reddit said. It had psilocin. It had pregabalin, which is Lyrica, okay, which is a prescribed medication sedative for seizures. How did they know? Muscimol and ibotenic acid. So I just have to say that the NPDS was able to find this product. I'm sure there was loads of other people taking this stuff, but they didn't get sick. And I'd have to say there was something that's meticulously crafted. I don't know how meticulously they crafted this, but maybe somebody got a bigger dose and somebody got a smaller dose, or maybe it wasn't mixed up that well. I don't know. We don't really know. But it was a very clear temporal association. All right. So going on to GI irritant was number 5, right? So how can GI irritants be in the top 5 of moderate or severe mushroom poisoning? Well, it was. There was 42 moderate, 1 severe. So you can get, like, from severe vomiting, you can rupture your esophagus. And that's, I would theorize, I don't know for sure, but I would theorize in that situation, you have scarring of your esophagus, probably wouldn't be able to swallow for some time. And it would be a problem that would put somebody from just bad vomiting into the severe group. Or they got so hypovolemic or low blood pressure, dehydrated, that can cause severe effects, possibly. And so there's a number of different mushrooms that do that. There's some pictures there and names. Usually the symptoms happen within 2 hours. And of course, nausea, vomiting, abdominal cramps, and diarrhea, very unpleasant. And the treatment for that in the hospital is basically lots of fluids and anti-vomiting medicines. And there is no really good anti-vomiting medicine over the counter. Bonine is probably the best you're going to get, but it's kind of weak. It's good for seasicknesses, but for severe vomiting, all those prescription anti-vomiting medicines are a prescription that you get at the hospital. Okay. So I just wanted to bring this in because death is like the worst endpoint, of course. And this was a case that came up last December of a Utah man who thought he purchased psychedelic mushrooms from somebody. He developed severe nausea, vomiting, and diarrhea. He wound up then going to the hospital. I don't have all the timeline on this. He wound up developing low blood pressure, hypotension, acidosis, fulminant liver failure, and he died 36 hours later. And the Poison Center said this is most certainly consistent with a cyclopeptide or amatoxin poisoning. But yet he wound up purchasing what he thought were hallucinogenic mushrooms. And so I racked my brain, how could anybody do this to somebody? How could anybody? But I think that there are those Gallerina mushrooms out there, which are known cyclopeptide mushrooms, right? And so did somebody mistake this? We don't know. There's probably a investigation going on. Maybe we'll find out later. Maybe we won't. So that brings us to the liver toxic mushrooms. All right. I like to call it cyclopeptides because there's a whole family of cyclopeptides that are in these mushrooms like Amanita phalloides. We saw some Amanitas out there, Gallerinas. And the primary toxin is alpha amatoxin and beta amatoxin, but mainly alpha amatoxin. And it is this big giant molecule right there. All right. So we don't know. We do know that we know that the Amanitas, Lipoides, and Gallerinas do contain it, and that's our knowledge at this time. Are there others? Maybe the Chinese will find out. I know that they have Amanitas with cyclopeptides in China, obviously, but maybe we'll find out more information from them as time goes on. And what amatoxin does in poisoning is that there's this phase 0 where people eat these mushrooms, like especially Amanita phalloides, and they say they're delicious. Okay. There's nothing off about them. Unfortunately, during this phase 0, the amatoxin is rapidly absorbed. And we know this. When we do studies on dogs, what we find is that if we collect all of the amatoxin being cleared through the urine over time, 85% of it is cleared in the first 6 hours. The symptoms of nausea, vomiting, and really watery diarrhea do not occur for 6 to 18 hours after you ate it. So we know that these get absorbed very quickly. The onset of bad GI symptoms happens later. And so people can wind up going on to develop such bad dehydration that bad fluid losses, the diarrhea and the vomiting, is that they can get severely dehydrated. All right. And that is actually a mainstay of the toxicology. You can wind up going into kidney failure if you get that dehydrated. All right. And so by the time this goes on for a while, usually they'll seek care at this point. All right. So if you call the Poison Center and you ate a mushroom and you're having vomiting and diarrhea and you're really, really having bad diarrhea, we're going to tell you to go to the hospital. And we may even direct you to go to not the hospital that's 5 minutes away, but maybe the hospital that's 30 minutes away that has a higher level of care, depending on your symptoms. All right. If you can get there. And then we have the second phase where people start to feel a little bit better, usually with treatment with IV fluids and anti-vomiting medicines and all that. People do start to feel better in the next 12 to 36 hours after that. But during this time, we can do a lab test seeing that the liver enzymes, which is kind of a measure of liver cell injury, starts to rise. All right. And then we get into phase 3, which is usually after 2 to 6 days, where we wind up manifesting multiple organ failure. And what this is that liver damage is one thing, but liver failure is a different thing. When you have liver failure, you cannot regulate your blood glucose. Your protein cannot metabolize lactate, which is, so you get acidosis. It cannot metabolize ammonia. So you get high blood ammonia, which causes confusion and whatnot. And you can't even clear bile. So you get jaundice. All right. So that starts to progress over time. You also cannot make clotting factors. So you can't make blood clots, and that can lead to, like around your IV, oozing blood or frank bleeding. All right. And then you can't make albumin, which is a protein that maintains your osmotic pressure in your blood. And so you can wind up developing problems with fluid retention or brain swelling. Okay. So it's all kind of really bad. The other thing that happens is that you do have, there's evidence for direct kidney failure, not just from hypotension. And so you might stop making urine, you can get fluid overloaded and wind up, your kidney balances a lot of your electrolytes. And so you get electrolyte imbalances. And then during this time, any infection is just bad news. Okay, so a lot of people who are vomiting that bad might choke on their vomit a little bit. And normally we can kind of recover from that. But if that turns into an infection at this point, that's actually, even if you survive your liver damage, you might die from the lung infection. So, and then, the final, if you don't come back from that, now the liver has great regenerative capacity. So, with the treatments that I'll talk about, if people go to the edge and come back, that's wonderful. But if that's going to happen, it's usually going to be in the period of 4 days to maybe a couple of weeks after, maybe a week, maybe a couple of weeks. All right. And so I'd have to say that, 85 to 95% people do survive. There is probably, but it is responsible for about 90% of the mushroom deaths worldwide.
There was a chemical they called silymarin, I think.
Yeah, I'm going to talk about that next. Okay. So what can we do about it? Can we prevent absorption from the gut before it gets absorbed, before you absorb it? Well, people don't even know they're sick until they've already absorbed it. But we still try to give some activated charcoal, which is a really good binding agent, right? Well, let me just kind of go through this cycle real quick. So you absorb this giant molecule from your gut. Of course, all of your gut vessels drain to your liver first, and then it gets absorbed into the liver, and then it winds up getting cleared in the bile, right? So in the liver, it winds up disrupting RNA and DNA and setting off a whole host of toxic reactions. And then it's secreted in the bile into the intestine, and it's recirculated for 36 to 72 hours. So it's kind of like a cycle. All right. So what we can do is try to interrupt this green thing. We can't really interrupt the absorption because that happens in the first 6 hours before you really know you're sick. So we can wind up trying to absorb it, bind toxins with charcoal, right? We can try and block transport of the drug into the liver cells because that's a giant, giant molecule. It needs to go through two different receptors to get intracellular into the cells. So we can give something called high-dose penicillin. I think most people have heard penicillin, but it's the old penicillin G. So they get 2 million units over a day. And so what happens is that competes with this receptor for absorption. So you can wind up maybe making a difference of the recirculated stuff getting back in. All right. And then we can give the free radical scavenger N-acetylcysteine, which we usually use for Tylenol poisonings, to try and absorb free radical oxidative compounds in the liver. And then we like silibinin, because silibinin might not only block some of that absorption, but it might also block some of the intracellular triggers that cause liver death, cell death. All right. So those are some of the antidotes, what we consider antidotes that we can use for this. The supportive care includes IV fluids. So you got one IV with IV fluids going. Glucose, they can put glucose in that same IV. Lactulose, that goes down a tube, an NG tube into your stomach. Lactulose binds ammonia, so you can try and decrease your ammonia if that gets that bad. You need blood transfusions. That goes in a different IV, okay, to replace your clotting factors and things like that. Electrolyte adjustments, that might be able to be in this one IV. Albumin infusions, that's a different IV. Kidney dialysis, that's a port. And then antibiotics if needed. So people in ICU with these things are really hooked up. And it's really kind of a miserable experience if, trying to do everything for the body that the liver does naturally. Okay. When the liver fails. Okay. And it's really hard to predict. We don't have really good predictors of who's going to go on to that point. Okay. The group of 3 people we had poisoned in December, January, one of them got discharged after a day and a half. Another one got discharged after a week. And the other person was in hospital for 6 weeks, hanging on, but he made it without a liver transplant. So he did a good job. So other mushrooms. So these other mushrooms, again, are a black box, and we don't know really what they are. And it's, again, makes a case for syndromic type of kind of classification. So if we think about other things in the United States that might be poisonous, that didn't make our top 5 or 6, there are some kidney toxin mushrooms out there. There was one arelanine that I saw in this 2023 data set. It's pretty rare. Causes kidney failure, but it's delayed onset, like 3 or 14 days later, you start to have the kidney failure, not right away. It's not weird. I don't know why. So, there's the gyrometrin, which is a neuro and liver, that usually has a 5 to 10 hour onset. That, again, didn't hit our top 5 or 6. There's muscarine, which is muscarine is kind of like a cholinergic agent. And so it causes a lot of symptoms like bradycardia, a lot of fluids coming out of everywhere. And if somebody eats one of these and has any underlying cardiac issue, their heart's probably not going to tolerate it pretty well. But usually people get sick within 30 minutes. So there's this temporal relationship with, I ate the mushroom, I got sick within 30 minutes, probably related. All right. There's neuro and cardiovascular with the coprine. Again, if you don't drink alcohol, you're not going to have a problem with that. And then there's some muscle toxins from some of these rusula and maybe some other mushrooms. In this country, the muscle toxins happen within 2 hours. And some elsewhere in the world, it's later. And then there's Morchella. I don't know. The neuro thing, rarely. I mean, that's isolated case reports, right? But then what about what happened in Montana? Well, yeah, the Morchella. So let's go into Morchella a bit more. So Morchella, morels are delicious, and we like to eat them, and people eat them a lot. But there's this rare outbreak of this neurologic syndrome that happens periodically. And it's at least associated with it. And the onset's within about 5 to 12 hours, where people develop some intestinal symptoms, vertigo, ataxia, maybe syncope where they faint, confusion, lethargy. And at this point, that's symptomatic care, and there's not been any deaths until last August when Dave's Sushi Restaurant was serving these morels that were not cooked. They were dried morels from China that were reconstituted and marinated with some kind of salmon roll, a special roll. And 49 people got sick and 2 people died. Okay, but if you look at the symptoms, they had vomiting and diarrhea, abdominal pain, and dehydration. Now, is that the same which has been reported before with Morchellas? Not really. So, they wound up, actually, again, the federal agencies got involved, and they wound up looking at this and trying to look for anything else. When I read these cases, I thought arsenic. It sounds like arsenic to me. They got sick, they developed this, they developed that, and a couple people died. Okay. But it wasn't, because they wound up doing analysis for every kind of bacterial compound you can imagine, any kind of toxic, heavy metal, pesticides, everything else, and they couldn't do it. So I have to say, I think that the cause of this was not Morchella. I think it's an unknown poison, that these people got sick, And it's really not consistent historically with what we'd expect with these rare random Morchella associated outbreaks, which I'm not even sure if it was Morchella. But anyway, so I don't want to, so sadly, in our National Poison Center database, it was actually acute Morchella sextulala ingestion probably responsible, because they were able to rule out the salmon and all the other ingredients. And there's this mushroom. And I think when you say mushroom, a lot of people get nervous. But so there was, I would say, a correlation, but I think the causation is still unknown. So I'm not sure. So to wrap up, sorry. I hope that you got a little bit of appreciation of kind of some mushroom poisoning problems that we see on our end at Poison Center. Kind of awareness of different types of what we call toxidromes or clinical symptoms of mushrooms, kind of the respect for the power of mycotoxins. I hope that you would all be very careful foragers. And if something seems like, things are really getting out of hand, that, calling the Poison Centers, it's free, 24 hours, and we'll give you our best advice. And when we want it, and and I have to say the Poison Center database is the best that we have. And it probably can help somewhat defining more what different toxic syndromes are, and maybe promoting public health and awareness. That's all I got. Got some references.
There was a botanist that was making a comment that he said there was 10 times as many poisonous plants as there are mushrooms, which is kind of interesting.
Well, I think there's probably way more than 10 times of plants than there are mushroom varieties. Anyway, if you just look at the worldwide thing, but yeah, I mean, plant poisoning. So it's actually a field called toxinology, which is the study of natural toxins, which fascinates me. The whole snake venom thing kind of fascinates me. Poisonous plants, mushrooms, it all fascinates me. But yeah, there are a lot of plant poisonings too, and they can be devastating as well.
In that sushi morel incident, so if not the mushroom, then what do you suspect?
I really had no idea. I mean, they wound up doing a really extensive evaluation. They genotyped those mushrooms that they got from China, and were, thinking that was there anything they combed through everything that was there, and to wind up making that many people sick. And it was on the 2 dates that they made the special roll. And so I don't know. We need more information. And I know that there's only one toxicologist at FDA, my friend Keith Burkhardt, but I don't know how many toxicologists were on this case. And I think sometimes you need a toxicologist because we think about all the weird stuff that happens with things like, like the serotonin 2B receptors in the heart. And is that going to be a problem as psilocin is used more and more widely? Like we saw with fen-phen, we didn't even know that was going to cause heart fibrosis for 7 years. It took to get that drug off the market. Yeah.
Are you familiar? At the same time, actually, same year, there was a man from Montana, but he was hiking in Utah. He used dry morels that he had actually gathered some of them. And he died too. And he had cooked them, but this was at high elevation in a very low stove. So it wasn't necessarily high heat. And that's been so that
Was he somebody who was pretty knowledgeable about what he was foraging for?
yeah. I mean, he had extras.
Yeah.
And
Well, that's one thing we say, different mushrooms can grow in the same area. And if you wind up accidentally leaving the amanita in your basket, like we were talking at dinner, and the stem falls off, it gets chopped up in with the rest of the stuff, and yeah, it's bad. I don't know. It doesn't typically happen. No, I think people are really careful. I mean, all you hear, like learning about mushrooms and how to properly forage, I think when people call it poison center, say, if you want to go out and forage, you need to join a mycological society and get trained. You don't want to just go out and try and do it willy-nilly. Oh, yeah, back here. Yeah. Well, I know that there's a lot of mushroom poisonings in Europe as well. They have a huge data set with their poison centers. Happens there too. I think they have a bigger mushroom culture probably than most people in the United States.
You know, people are developing for antitoxin.
There is. Well, the test that was developed was for urine, and I think that it was something that was promoted for veterinarians. It was never approved for human use. And I think, I'm not even sure if they're still making it anymore, but it was something that you could wind up doing a test and detecting, I don't know for how long, but it was for dogs mainly who eat. I think that what I find in my work, a lot of our cases are people who are immigrants and unawares that the mushroom might even be bad, to be dangerous. They have really no idea. Or they're sold something that they thought was safe. Or, that's a lot of the cases. I did have a case in was it 2017? I think it was. Some kids who bought dried mushrooms. They were told were hallucinogenic mushrooms, and they wound up with, I'd say, mild to moderate. And it clearly wasn't a psilocybin mushroom because they didn't have psychiatric type of effects, and they wound up having amanita or cyclopeptide type of effects. So, I think and it's not something that's super common in California, even though they're here a lot. And I think that the word has gotten out through, channels that, mushrooms can be toxic here. And hopefully it scares a lot of the people away who don't have the expertise to be able to go out picking mushrooms. Go here first. Yeah.
So if you see a dog or somebody ate one of those, would you want them to ingest charcoal as soon as possible, like on the way to bed, or would you swap?
Vets treat things so differently than we do. Oh my gosh. Usually vets induce vomiting with something called apomorphine. They might tell you to use hydrogen peroxide to cause vomiting in your dog. But I think that what we saw in the human studies and why syrup ipecac was taken off the market is that it only brought back about 30% of what went down in humans anyway. So inducing vomiting kind of fell by the wayside. Is it going to make that much of a difference? 30% lower dose of amatoxin? I don't know. So I think if it were my dog, I would probably say, we'll give him something short acting maybe, but give him the charcoal, follow it up with charcoal. And I think that there's some other dog poisons with the new rodenticide that's out there that is, I think, worse than the anticoagulants. And for dogs, they do give charcoal for that, multi-dose charcoal. So, yeah.
2 questions from online. I wonder if you think the man who died from psilocybin mushrooms, he, quote unquote, actually foraged them himself, Did anyone else die of purchased magic mushrooms in that period of time?
No other reports that the poison center had. So, but that's all we have. I was going to call the medical director up there and see if they found out anything more, but it was just the isolated case.
Second question, any news on the recent poisonings in Monterey County?
I briefly, one of them, there was three, and I can't go into much detail because it's, but they were three people, and we got some different stories. And I'm not sure, the police investigated, and I think that there was a question whether or not they were sold mushrooms or if they went out and forged them. And I think there was a big question about that, and I think that they may have been forged. They didn't know what they were eating was toxic. And the question I got is, why am I the sickest and I ate the least? And that person was in the hospital for 6 weeks. And the other ones got cleared sooner. So I don't know. Usually the dose makes the poison. The more you eat, the sicker you get. So I don't know. And again, we don't have a lot of data. So we're not doing like a drug study where we're doing metered doses of poison and figuring out what happens. We're getting bad history. Yeah.
There was one mushroom, I think it was the coprinus,
Coprinus.
that if you consume alcohol in 5 days, it's toxic. What's the mechanism of that?
So I don't know if any of you have heard of like anabuse, which is an old treatment for alcoholics where so alcohol is metabolized to an aldehyde and then to basically acetate. So your body oxidizes it. And the middle, so there's two enzymes that are involved, alcohol and aldehyde dehydrogenase. So anabuse and coprine inhibit aldehyde dehydrogenase. So you built up the toxic intermediate of the alcohol, the acetoaldehyde, which is like what gives people headaches and vomiting and palpitations. And it makes people feel so bad. That's why anabuse, they thought it would be a deterrent. And you don't need a lot. People I've had people accidentally swallow a mouthful of mouthwash with alcohol in it and go on to have a reaction. It doesn't take a lot of that same thing in people who, sometimes they say Asian descent people don't tolerate alcohol very well and they get very flushed and they don't feel well and their heart's palpitating. Same type of thing. Their aldehyde dehydrogenase is slow. And so you get a buildup of this intermediate. Same thing happens with coprine, and it binds that enzyme so well for about 5 days until it's gone.
Have the toxins been isolated? I mean, do you know they're all, but
well, a lot of times we do, but sometimes they're not. So there are some syndromes that are associated with different mushrooms where they're not absolutely sure. So I'd have to say that yellow night triclo, whatever thing it is in France, where it's eaten commonly, but some people get this muscle toxicity from it. So I'd have to say, I think that you don't know what the cause is. If it doesn't happen in everybody, you'd have to think, well, maybe these people have some deficiency or some kind of risk factor. For example, the liver toxicity that occurs from gyrometra poisonings. That's not the same as cyclopeptide. It's not the same as other types of things. What it is people who are fast acetylators. So there's an enzyme in your liver that acetylates drugs to get rid of them. So there's people who are fast acelerators, slow accelerators, and in between. And so people at either spectrum can be at risk of different types of toxicity if they have this acetylator type, right? So maybe, you know, the muscle toxicity from this other thing that we don't even know what the compound is, maybe there's some people who are more susceptible. We just don't know. So I always think that, you know, you have to be very careful of blaming something on something if you don't have clear causation criteria. There's about 9 criteria for causation, because you may miss the real answer. So.
Yeah, it says mushrooms that were contaminated with something. Those poisons, because I didn't see it.
Yeah, you know, that it's a possibility. So, you know, but I think that's poorly defined. You know, anything can spoil with bacteria. You know, if you're picking things in a cow pasture and those cows have the bad E. coli, then, you know, you're going to wind up getting sick with an E. coli kind of gastroenteritis. Possible. You know, so I think there are possibilities, and I think that you want to make sure that your mushrooms are not, if you're going to eat them, are not decomposed. I think that's kind of a general thing. You want to usually cook your mushrooms, and you know, make sure that they seem to be intact. You know, heavy metal. So that's kind of interesting. So in my toxinology kind of thing, some of the herbs that we wind up getting that people might use, there are certain herbs and plants that will concentrate heavy metals from the soil. And so there are certain herbs, turmeric is one of them, that might concentrate arsenic and lead. So if you're in the Himalayan lowlands where there's a lot of arsenic in the water, those plants harvested from that area, or even rice in that area, will have high levels of arsenic naturally. So depending on where it is, I don't know if mushrooms are the same. I don't think anybody, I've never heard of anybody talking about that. But we've talked about in plants and herbs because there's been dietary supplement poisonings with lead, arsenic, and mercury at the poison center. And then you wonder, was this something that was added to it or was it something natural? But you know, things that are coming in from foreign, you don't really know what it is.
There are several speed mushrooms.
Really? Really? I would love to know about that.
Actually, how come I asked? Because as far as I know, there's one case from New York State, somebody eating morels, which there were that arsenic from years ago. But they had to eat them for 22 years, pounds every year before symptoms. And so I see these recommendations about not recommended to eat this, but I don't know if any were just eating it a couple times. But
well, it's really interesting.
That's what
yeah.
I wondered.
There's some of the mushrooms that are in China and other areas that it almost seems like it's an allergic or some kind of immune mediated reaction on bone marrow that after several exposures previously, all of a sudden they'll wind up like with bone marrow with like low blood counts. Okay. And so there are some weird toxins out there, but I don't know. Yeah.
There was an article about the pigs in the Chernobyl area. Interest in some of the troubles there, and they were more radioactive apparently than some of the other animals were, you know, eating grass or leaves or browse or something like that.
So yeah, pigs eat everything. I don't know.
They were picking up something, the truffles that they were eating was able to extract something from the soil that was more radioactive than the plants.
Well, I think you'd have to look at that pretty quick. You know, the funny thing is about pigs, I was looking at doing a study once with the Army and we were looking at mercury poisoning. And so in the chow for the pigs, they actually have to put small amounts of arsenic in it. It's part of their diet, their recommended daily allowance, which is that's not for other animals. But that's what you find out from the veterinary people. It's just
Yeah.
like, wow, the animals are so different than us.
Yeah, it wasn't a very comprehensive article.
Yeah,
It's-
I would say don't be careful about blaming something on one thing because you
Yeah.
might be missing something else.
I don't know, the connection is all that secure. Yeah.
Mm.
Comment from online. Amanita muscaria may concentrate vanadium.
I have no idea.
What is that?
It's one of the, we'd have to go look at the periodic table.
Yeah,
Vanadium.
I don't know.
that's true, but I think again.
Well, interesting in the arsenic, it is a chronic, there's two forms. There's acute and chronic type of, and the chronic, if you look at the people in the Himalayan lowlands where they put in all of these nice wells, their aquifers are contaminated with high amounts of arsenic. And their arsenic a big model for chronic poisoning of arsenic in that area. It's sad, like 30 million people.
Do you anticipate that like all this microdose that's unregulated, that's going to increase like your database having more?
In the last 35 years that I've been there, there's been waves of things. So things get popular and then they go out. There was the synthetic cannabinoids for a while, ever since the internet, 2004. And the dark web, oh my gosh, and then, all the stuff that they're making in China and shipping over here, they are they have like chemists there that are just like designing, like it's not even fentanyl anymore. It's these nitrazine compounds, which do the same thing as fentanyl, but you don't get them on a tox screen. And that's that's starting to come in now. So there's these waves of different things. And I think that right now there's a lot of deregulation for different types of psychoactive substances that people would rather, it's popular. And I think that part of it is access. And so you have access to something, you'll have more exposure, right? So we know that from a lot of different models, a lot of different poisoning models. I can go on all night. But so for example, in the United Kingdom, they restricted the number of acetaminophen tablets you can get in a jar. And if you needed it, you'd have to punch them out. The number of acetaminophen liver poisoning deaths went down when they did that intervention. Same thing when we had iron. We had 6 pediatric iron deaths within 6 months in 1997. And we wound up going to the FDA and say, can we just put a warning? Because people didn't think that iron would be poisonous. But for young children, it can be devastating. And because it only takes, a few tablets of adult strength. And then they put them in unit dose. And so our iron poisonings basically went way down after that. And again, it's access. So I think that when you bring something up and you may liberalize it, you'll have more exposures. Like we never used to get pediatric cannabis poisonings. And now we have marijuana babies, at least 1 or 2 every day, ICU, just in our little area, who have had a seizure or on a breathing machine, something else. And we never had that before because they're candy. They put them in candy now.
What form are they taking?
It's usually an edible. So it's access. So if you liberalize access, you're going to have exposures. Anyway, that's all I have. Anybody else have a question? No? Okay.